In the initially, I wanted to do that at university in order to understand myself and also people around me. When I came back into Malaysia, I did discover that there's not much psychological help for the public. And quite a number of my medical practitioners, colleagues, encouraged me to set up a practice to offer help to these people who very much needed the help that were not available. Well, I have been setting up the practice of International Psychologist Center now for more than 15 years. And although the need from the public for psychological help is very much there, that there is a general lack of awareness of where to seek the help. So for example, family practitioners, they very often have patients who needed this help, but they do not know where to refer these patients to, and they themselves do not have the time nor the training to help these patients, and even many public hospitals do not have psychologists, or if they have, there will be a very long waiting list to get this help. Well, obviously, there's still a gap compared to what is happening in developed countries. Frankly speaking, many of the patients that do come to see us are still doing so more because that they are very much in distress and that they have much emotional pain, rather than coming to us for growth reasons, that they want to develop more awareness or improve their relationships when there are no specific issues or problems. So yeah, there's still very much the need for Malaysians to come in earlier to seek psychological help. There is definitely some development as I've been practicing for more than 15 years now in Malaysia, that there are more awareness definitely help. I might add through the very much the effort of International Psychologist Center, who has pioneered our efforts to raise awareness amongst the public. We have, for example, embarked on many different campaigns about different disorders, from depression to anxieties to relationship issues to a lot of even taboo subjects such as sexual dysfunctions, whereby we provided public talks that we have in the early days, promoted through the printed media, and visits to doctors and other institutions such as schools, religious institutions, and now in the past few years through the social media as well, and various magazines. And this year we are launching our own psychological health magazine. So through all those efforts, there have been increased awareness but there's still much to do because, like I say, most medical practitioners still are not aware of the need that is available. And the other big area for development is in corporate organizations. There are a lot of organizational stress, which affect the performances, medical leaves, and high turnovers in organizations. But most organizations do not have a panel of psychologists that they work with, and they do not have a structured, formal psychological program like what is available in developed countries, such as the Employee Assistance Program, which is a psychological support program paid for by the company and provided to all employees. And organizations in developed countries see the value of doing this because they see that it will ultimately affect the bottom line in the organizations. It would cut down the turnover rate, it would increase productivity, and directly affect the profit of organizations. IPC, through its corporate psychology division, have been trying to increase an awareness in organizations to do this, but there's still a lot to do. We are, for example, taking part in giving a super workshop in the International EAP conference in San Diego, October this year, for example, about the EAP situation in Malaysia. So we're doing our part, but there's still a lot that needs to be done. The other issue is, of course, there's no direct governmental support or infrastructural support for those that seek psychological help. There's no insurance coverage, for example, for people that need psychological help. Most insurance policies in Malaysia would not cover you if you go to see a psychologist for depression or any diagnosable psychological disorders, unlike developed countries. Well, we have, in fact, over the past years, tried to approach various insurance companies, but their resistance is that they claim that there's no precedence in Malaysia, that there's no data available of what type of exposure of risk that they might be getting themselves into. So insurance companies are not very, traditionally not very much of risk takers. So for these reasons, until we have come up with a business plan for them that it is actually, I'm afraid, the word has to be used, profitable for them to embark on this coverage, they're not willing to do so. So that is what we have, and indeed we have good data from employee assistance program research and some of our own data to support that, but we need to continue talking to them, and what is needed is some governmental push as well, for the ministries to endorse some programs that might give them the confidence that they need. Well, all sorts. We have different divisions at the International Psychology Center, from children division as young as 2 years of age. Parents would bring the children to see us for various reasons, from symptoms whereby they see that their children might not be developing normally, there might be some lack of social interactions, lack of verbalization or non-verbal abilities, to teenagers who have issues of disciplines, of social behavior problems, learning issues, attention problems, to adults, young adults with career issues, and couples who have relationship distress, caused by various things, from marital affairs to lack of enjoyment, of a lack of intimacy of their relationships, and of course the various adult psychological disorders, from addictions to depressions to full-blown psychosis. So we will have clientele from all walks of lives, all genders, and all different ages that come to us through our different divisions. There are two general ways to cope with stress: positive and negative. In fact, we have a lot of people who use the negative ways of coping with stress, namely many addictive type of behavior, from smoking to taking drugs, alcohol, pornography addictions, even shopping, even working too hard. These are all ways to avoid dealing with problems caused by stress. And of course, there are those who take or who abuse psychiatric medications as well, like sleeping pills are one notorious examples. So we need to help these people to convert their non-productive ways of coping with stress to more productive ways of coping with stress. And these include not only good work-life balance, good exercise, healthy recreational activities, good relationship, even religious, spiritual type of support system, good family support system are all recommended. And in fact, in the International Psychology Center, we have developed various programs, activities like during the school holiday, we have a rainforest, nature and emotional intelligence camp designed for children and teenagers to come and enjoy and learn productive ways to deal with stress. So you might look at that as stress inoculation program, very much like inoculating your child against flu. You can inoculate them against psychological stress, so that then they will become more resilient and be prevented from developing other psychological disorders. We have developed similar programs for adults as well, which we have introduced to corporate organizations, from stress management to emotional intelligence development at the workplace, and also relationship programs and camps as well. So there are many ways one can have more productive ways of coping with stress.